that new reports that recommend statins for millions more Americans to cut their cholesterol are coming out this hour, these reports. I want to bring back our chief medical correspondent, Dr. Sanjay Gupta. Sanjay, sorry about those technical difficulties before.
Happens.
What makes these new guidelines so monumental?
Well, you know, as you mentioned, Jake, this is a huge shift sort of in the way that we think about cholesterol and probably heart disease overall. Obviously, a continued focus on trying to prevent these problems in the first place, but also this idea that, look, we have a better idea of how heart disease develops, and should more people be on statin medications. It's interesting, a lot of people know their numbers, so to speak. They know what constitutes bad cholesterol. You want your total cholesterol below 200, your HDL, which is your good cholesterol, above 60, LDL below 100. Now, I throw those numbers at you because a lot of people know these numbers, but as you pointed out, they're not that relevant anymore in this new sort of paradigm. Instead, they're looking at just some specific risk factors and saying, you take a statin if you have diabetes, period. That's it. If you have evidence of heart disease, doesn't matter what your cholesterol is, you take a statin. If you have a bad cholesterol over 190, that's usually in people who have congenitally high cholesterol, they take a statin. And also this final thing, this 10-year risk. If your chance of developing heart disease over 10 years is over 7.5%, you take a statin. So this is a big difference, not only in how many people are going to take statins, but in the way that the medical establishment sort of approaches this whole thing as well, Jake.
And Sanjay, explain this 10-year heart disease risk score. What is that, and how is it factored? How is it figured out?
This is sort of a little bit more of a potpourri. This involves a few different types of risk factors, including things like blood pressure and family history. There was a study known as the Framingham Heart Study. You may have heard of this. It was one of the largest heart studies that made some links between cholesterol and heart disease. This takes in several different factors and then calculates a risk. Your doctor can do it for you. Eventually, the American Heart Association is going to have a calculator on their website as part of this whole thing. So you can just put in your own numbers and your own history and blood pressure and figure out what your risk actually is.
And Sanjay, some experts have said that these new recommendations that are out just this hour, just out in the last 9 minutes, could double the number of Americans taking statins. Is that safe? What are the side effects?
I think, first of all, it's accurate that if you looked at this and looked at how many people would now qualify, it could be double. It could go from around 35 million closer to 70 million. Is it safe? It's a good question. You know, even as a doc, you know, I ask a lot of questions before prescribing medications. There are side effects from these medications. You can have muscle aches, which may sound like a small thing, but they can be profound. People may not exercise or be as active anymore. It can cause liver problems, and people have to have their liver sort of evaluated from time to time if they're on these medications. But there's almost a larger question here, Jake, and it's about the role of interventions overall. If I went to the doctor and said, look, am I going to live longer as a result of taking a statin under these new guidelines? That's a harder question to answer, Jake. While it may decrease the amount of heart disease, decrease the number of heart attacks and strokes, all very important, the outcome of longevity of life is a little less proven. So that's something that the debate goes back and forth on.